So Neil, I went on to it, like you asked, took a look at it, and just some points. From a mobile perspective, I think the majority of us now are mobile users. You really can't, it actually doesn't pop up. Like it's not mobile friendly at all. So it's feedback to you. But what I draw from it is when you look at the percentages in terms of by racial demographic, the way you guys presented it, there's a large bar for white and then exceptionally small bars for both Hispanic and African American and all the others, comparable to what I believe Dr. Fine was saying in his testimony. And I went back and I also looked at the percentages for different municipalities. And I see that, one of the municipalities I represent is around 58, less than 60%. Very comparable to, say, Newport. And then you get Tiverton, Little Compton. It's funny, and some of the more urban areas are higher than those. And one of the reasons why I've been so vocal on this issue in terms of the vaccine mandates, stuff like that, because I know within my district that regardless of hesitancy or non-hesitancy, mandates or non-mandates, I know that the residents of my district are going to be disproportionately impacted by these mandates just based on the numbers. So again, because of that, it's one of the reasons why I've been so vocal on these things. And how do we not look at this and see that these mandates aren't only going to have a disproportional impact on just Burrillville or just Tiverton, but even on these areas in which we tried so hard to avoid. I mean, our first round was specifically targeting specific racial demographics. And just based on what I'm seeing, it shows that we failed at that. But now we're going to mandate it. So folks are going to lose their jobs. It's folks from my district and then folks from Central Falls, Providence, Newport. They're going to lose their jobs over this. And I understand that there's public health concerns, but the desperate impacts on certain communities is just blatant to me. And I just haven't heard anybody talk about that yet. So I don't know if someone wants to touch on that. Neil, I know you're just the data guy. You're not necessarily the policy guy. But Dr. Fine, if you want to touch on that, I'd welcome your comments.
Dr. Fine, please. Neil, speak to that first.
Sure,
and then
sure.
Dr. Fine.
Thank you, and I thank you for the compliment that I'm a data guy. I am not a data guy at all. I have a great team of data people behind me. I'm just a public relations guy that's happy to help out. But to your point about targeting the disproportionate effects that we saw early on in the pandemic, that was a really big focus for us, to focus on where we saw a very disparate population of hospitalizations, deaths, related to COVID. That's why we started with our limited supply in those areas. Going out further, completely agree with you. We need to do more to make access to the vaccine more accessible in all the communities that you're seeing that you mentioned, Little Compton, Foster, Gloucester, because ease of access is also going, once you get somebody over the hump of vaccine hesitancy, making it easily accessible, continuing to make access free is going to be just as important. So there's kind of a twofold battle we have there. We're focused really hard on both of them, and would be happy to partner with you on anything you think would be beneficial to reach those in Burrillville.
Well, I would say just about anything but a mandate, because I know, speaking for my communities, government mandates don't tend to build trust. And that's something I've been saying from day one. I mean, I've had legislation heard, dealing with mandates and vaccination cards and things like that. And one of the things I tried to do for your director was, quite frankly, set her up for softball questions. In my mind, there are softball questions. There are common questions that are being asked in the community that I think can be directly answered and explained, but they weren't. And my frustration obviously showed in the fact that these very direct, simple questions were asked, but not directly answered. And folks in these communities, whether it be Newport, Tiverton, Burrillville, Central Falls, they're not unintelligent people. They can understand the reasons behind things. They can also see when someone is giving a BS answer. I mean, I think some of these communities have some of the highest BS meters in the state. I mean, whether it just be mine or be Central Falls or wherever it is, I think some of these everyday hardworking people have the highest BS meters on, off the record. And unfortunately, this is my feedback. Stop BSing on certain things. Trust us to understand the real answers. Some of the answers I ask, I already have background information for. They're easily accessible. They're known. It's a simple question. And if you beat around the bush, people are going to be hesitant. They're going to cause the hesitancy. So you want my answer, Neil, in terms of how do I think you need to build the trust in these communities. And you build these trusts by being direct and honest with them. Don't BS them. And that's what I got. That's what I got as to the answers, because again, my colleague down here asked a very direct question, and it wasn't answered. And I had to then take up my time for my constituents to follow up and try to pull that information out. And it should be known. These are questions, you want to know? These are questions that are being asked. I'm asking these questions because people who are hesitant are asking these questions. People who have taken the vaccine are asking these questions. And they want these answers just to relax them. But if you BS them, it doesn't relax them, it doesn't build trust.
Yep.
So just be direct and honest. So you asked ideas, that would be my idea. When someone makes a presentation and a question is asked, be direct and be honest. Trust that we understand the reasons. So answer the question, then give us a reason. If you start to give us a reason but never answer the question, again, the BS meters go off. So there's my answer to your question, Neil.